Post-operative instructions, wisdom teeth. The removal of impacted teeth is a serious surgical procedure. Post-operative care is very important. Unnecessary pain and the complications of infection and swelling can be minimized if the instructions are followed carefully. 5 things not to do for the first 24 hours. 1. No smoking. 2. No use of drinking straws or carbonated beverages. 3. No hot liquids. Lukewarm coffee, tea, or soup is fine. 4. No vigorous rinsing with mouthwash or water. Mild swishing is fine. 5. No spitting. Wipe saliva from your lips with a tissue. Any of the above can cause increased bleeding after surgery. Some bleeding following oral surgery is to be expected. You will notice an oozing for 12 to 24 hours following the surgery. Pressure applied over the surgical areas by biting on gauze will decrease the bleeding. The gauze pad placed over the surgical area should be kept in place for 60 minutes. After this time, the gauze pad should be removed and discarded. Vigorous mouth rinsing or touching the wound area following surgery should be avoided. This may initiate bleeding by causing the blood clot that is formed to become dislodged. Take prescription pain medications as soon as you begin to feel discomfort. This will usually coincide with the local anesthetic becoming diminished. Place ice packs to the sides of your face where surgery was performed. Refer to the section on swelling for explanation. Restrict your activities the day of surgery and resume normal activity when you feel comfortable. Caution: if you suddenly sit up or stand from a lying position, you may become dizzy. Therefore, immediately following surgery, if you are lying down, make sure you sit for 1 minute before standing. Bleeding. A certain amount of bleeding is to be expected following surgery. Slight bleeding, oozing, or redness in the saliva is not uncommon. Excessive bleeding may be controlled by first rinsing or wiping any old clots from your mouth, then placing a gauze pad over the area and biting firmly for 30 minutes. Repeat if necessary. If bleeding continues, bite on a moistened tea bag for 30 minutes. The tannic acid in the tea bag helps to form a clot by contracting bleeding vessels. To minimize further bleeding, sit upright, do not become excited, and avoid exercise. If bleeding does not subside, call for further instructions. Swelling. Swelling is a normal occurrence after surgery. The swelling that is normally expected is usually proportional to the surgery involved. Swelling around the mouth, cheeks, eyes, and sides of the face is not uncommon. This is the body's normal reaction to surgery and eventual repair. The swelling will not become apparent until the day following surgery and may not reach its maximum until 4 to 5 days post-operatively. However, the swelling may be minimized by the immediate use of ice packs. To minimize swelling, apply an ice pack or a plastic bag or towel filled with ice on the cheek in the area of surgery. Apply the ice continuously, as much as possible for the first 36 hours. The ice pack should be used for 20 minutes on and 20 minutes off, without direct contact with the skin. If swelling or jaw stiffness has persisted for several days, there is no cause for alarm. This is a normal reaction to surgery. Pain. For mild to moderate pain, we recommend ibuprofen, also known as Motrin or Advil. 2 to 4 200 milligram tablets may be taken every 3 to 4 hours. For severe pain, use the prescription given to you as directed. The prescribed pain medicine will make you groggy and will slow down your reflexes. Do not drive an automobile or work around machinery while taking pain medications, and avoid alcoholic beverages. Ibuprofen, 600 milligrams, can be taken in between the doses of the stronger pain medication. Do not take any of the above medication if you are allergic or have been instructed by your doctor not to take it. Pain or discomfort following surgery should subside more and more every day. If pain persists, it may require attention and you should call the office. Diet. After general anesthetic or IV sedation, liquids should be taken first. Do not use straws. Drink from a glass. The sucking motion can cause more bleeding by dislodging the blood clot. You may eat anything soft by chewing away from the surgical sites. High-calorie, high-protein intake is very important. Nourishment should be taken regularly. You can prevent dehydration by taking fluids regularly. Your food intake will be limited for the first few days. You should compensate for this by increasing your fluid intake. At least 5 to 6 glasses of liquid should be taken daily. Try not to miss a single meal. You will feel better, have more strength and less discomfort, and heal faster if you continue to eat. Oral hygiene. No rinsing of any kind should be done until the day following surgery. You can brush your teeth the night of surgery, but rinse gently. The day after surgery, you should begin rinsing at least 5 to 6 times a day, especially after eating, with a cup of warm water. Discoloration. In some cases, discoloration of the skin follows swelling. The development of black, blue, green, or yellow discoloration is due to blood spreading beneath the tissues. This is a normal post-operative occurrence, which may occur 2 to 3 days post-operatively. Moist heat applied to the area may speed up the removal of the discoloration. Antibiotics. If you have been placed on antibiotics, take the tablets or liquid as directed. Antibiotics will be given to help prevent infection. Discontinue antibiotic use in the event of a rash or other unfavorable reaction. Call the office if you have any questions. Nausea and vomiting. In the event of nausea and/or vomiting following surgery, do not take anything by mouth for at least an hour, including the prescribed medicine. You should then sip on Coke, tea, or ginger ale. You should sip slowly over a 15-minute period. When the nausea subsides, you can begin taking solid foods and the prescribed medicine. If needed, an anti-nausea medicine may be taken. Other complications. If numbness of the lip, chin, or tongue occurs, there is no cause for alarm. As stated before surgery, this is usually temporary in nature. You should be aware that if your lip or tongue is numb, you could bite it and not feel it, so be careful. Call Dr. Falender if you have any questions about this. If the numb feeling extends beyond a few days, please call our office. Slight elevation of temperature immediately following surgery is not uncommon. Tylenol or ibuprofen should be taken to reduce the fever. If the temperature persists, notify the office. Be careful going from lying down to standing. You are not able to eat or drink prior to surgery. It is difficult to take fluids, and taking pain medications can make you dizzy. You could get lightheaded when you stand up suddenly. Before standing up, you should sit for 1 minute, then get up. Occasionally, patients may feel hard projections in the mouth with their tongue. They are not roots. They are the bony walls which supported the tooth. These projections usually smooth out spontaneously. If not, they can be removed by Dr. Falender. If the corners of your mouth are stretched, they may dry out and crack. Your lips should be kept moist with an ointment such as Vaseline. Sore throats and pain when swallowing are not uncommon. The muscles get swollen. The normal act of swallowing can then become painful. This will subside in 2 to 3 days. Stiffness, trismus of the jaw muscles may cause difficulty in opening your mouth for a few days following surgery. This is a normal post-operative event that will resolve in time. Sutures are placed in the area of surgery to minimize post-operative bleeding and to help healing. Sometimes they become dislodged, but this is no cause for alarm. Just remove the suture from your mouth and discard it. The sutures will dissolve between 5 and 7 days after surgery. The pain and swelling should subside more and more each day following surgery. If your post-operative pain or swelling worsens or unusual symptoms occur, call the office for instructions. There will be a cavity where the tooth was removed. The cavity will gradually, over the next month, fill in with the new tissue. In the meantime, the area should be kept clean, especially after meals, with saltwater rinses or a toothbrush. Your case is individual. No two mouths are alike. Do not take seriously well-intended advice from friends. Discuss your problem with the persons best able to effectively help you, Dr. Falender or your family dentist. Brushing your teeth is okay. Just be gentle at the surgical sites. A dry socket is when the blood clot gets dislodged prematurely from the tooth socket. Symptoms of pain at the surgical site and even pain to the ear may occur 2 to 3 days following surgery. Call the office if this occurs. Keep physical activities to a minimum immediately following surgery. Exercising may cause throbbing or bleeding to occur. If this occurs, you should discontinue exercising. Keep in mind that you are probably not taking normal nourishment. This may weaken you and further limit your ability to exercise. If you get lightheaded, stop exercising.